So I'm going to treat you as if you're doctors.
There are two main areas of focus in the videotape. Firstly, the way the language functions will be used to examine the drama framework. The changes in the social context and the communication system that the drama brings about will also be looked at. Secondly, the variety of language the pupils use to structure their own learning will be considered. The method used to look at this language is based on a form of systemic grammar outlined by Professor M.A.K. Halliday in his books Language as Social Semiotic and Explorations in the Functions of Language. This system identifies three main functions of language. Firstly, the ideational, or this is what I want to say function. Secondly, the interpersonal, or this is where I come in function. And thirdly, the textual, or this is the kind of message I want function. All three functions are present and intertwined in any utterance. However, most of the points that follow will be concerned with the interpersonal function of language, since it's here that the changes to the social context of the classroom will be most obvious. The interpersonal or social role function of language can be examined at the level of the clause in terms of the grammatical systems of mood and modality. The mood system consists of choices between different roles that the speaker can select for himself or his hearer. The modality system expresses the degree of certainty the speaker has about the statements he makes.
Of any of those? What do you think?
Get the facts.
You think getting the facts right. Anybody disagree with that? What do you think? You think asking other people is the best, yes? Do an experiment about it.
Watch someone else.
I wondered myself whether sometimes you can learn best by trying to tell others before you know much. Think you can do that? You think you have to know a lot before you can tell anybody else?
The teacher and pupils are working here in the normal classroom context. By using the hypothetical mode of I wonder, the teacher is inviting the pupils to consider the ways they learn. All of the teaching that follows is designed to eventually allow the pupils to extend their range of communicative initiatives and take control of their own learning by telling others what they know.
Then we talk it over. Then we make somebody else do it. Then we do it. Then we check the results. And then we tell other people. What am I going to do with this one then?
Maybe if they tell an expert, they would tell them how to do it exactly, or if they've got it right, or...
Yes, if you try telling somebody that knows better than you, they'd help you check if you were correct. Well, shall I leave it up there or move it down like this gentleman suggests? It's your examination, doctors. We're ready then. From now on I shall treat you as doctors.
It's interesting here that the teacher actually uses the term as if, which is a pivotal point in the assumption of the drama framework.
That will allow you to become doctors in the National Health Service of this country. I'm very pleased to see that you came in without any bags or coats, because certainly we should have had to take them away from you.
The teacher introduces the medical examiner's role by the use of I, which immediately sets her in opposition to the class. However, significant differences to the normal classroom context appear almost immediately. In the opening statement, the medical examiner, while appearing to assert her authority, is actually upgrading the children's confidence by complimenting them on their correct form of behaviour.
Fail this examination, you will not be able to re-sit it. But I'm quite sure that the training you've had will have thoroughly equipped you for any of the problems that you will face this week. Are you feeling nervous? Is anyone feeling nervous? Good. Very well. The examination will commence. We should like you, first of all, in your groups, to carefully study this room that we have placed at your disposal. Sir Joseph today will answer no questions. There are 3 questions you have to find the answers to and write down what you think. You do not have to wait to write what you know, only what you think is the truth.
The pupils are actively encouraged to bring their action knowledge to bear on their scrutiny of the portrait. They are encouraged to write down what they think from direct observation and from their own understanding of the historical period.
You know already he is a doctor. But what kind of a doctor? And what kinds of things would you expect to find him doing? Every time you have decided anything, write it down. I shall write the 3 questions on the board when I have transferred these cards to there. Let the examination begin now.
The final sentence of this speech is the use of the inclusive imperative, where the teacher includes herself among the performers in the action. It requires some reorganisation to make the structure obvious. Let us begin the examination now. The inclusive us of the complement is understood. Even though the pupils and teachers have different roles, they're all included within the drama framework.
She thought it might be the dance with the nose.
Looks like you've got the bloodstream and the, mostly the breathing apparatus, but this suggests the bloodstream as well. Yes, yes, yes. One does wonder what kind of bacteria the man might have been looking into.
The last sentence here is particularly interesting, in that it's composed of 2 finite clauses operating in the mood and modality network. The first, operating at modality assessed possible, and the second as an open interrogative. This is a clear indication to the pupils from the teacher in role that they have the rights and authority as experts to establish their own interpretation of events. That they do can be seen in the small group discussion that occurs immediately following the teacher's comments.
Sign your usual signature.
The drama framework is already allowing the pupils to formulate their own interpretation of the situation without depending on the teacher's frame of reference. The assumption of the drama framework has begun. This can be seen in the spontaneous use of the term doctor as they sign their written work.
For the excellent way in which you have conducted this first part of your medical examinations. Now, take this off. So, the examination for today is over. Was it interesting? I thought it looked rather interesting. May I introduce you to these doctors? They've taken the trouble to travel to meet you and to hear about your work. They realise that you haven't time for a big lecture, and so they have certain questions they'd like to put to you. Will you mind if they have a little discussion first?
Oh,
before
not at all, I
Very
understand.
well.
The following pupils' inquiries are requests for information and take the form indicative, open interrogative. The interrogative element expresses a request for a subjective emotional response from listener. This pattern is repeated later in the session, and it shows the pupils controlling the subject matter of the interaction.
Ask him loud enough so that he can hear well, you know, because...
What is it, I wonder, that drives people to become doctors? Lister's question takes on an indicative, open interrogative form. This musing, hypothetical quality can function within the drama framework because the convention has allowed the communication expectation lines to be relaxed. The old doctor can ask his young colleagues questions and expect a similar reply. It certainly is. It's a wonderful experience.
must be nice when you just save somebody's life, and they're all very thankful to you.
The pupil has responded to the changed communication expectation lines with a declarative, modality-assessed, probable reply that indicates he expects a sharing rather than judgmental response from Lister, a clear indication of the drama framework in operation. I'd run over his knee, just here, and he'd broken his knee, and the skin was broken. And of course they thought he was going to die. About every second one did. But he recovered.
Did anyone of your patients die?
Oh yes.
What did you feel like when they had died?
Well, I felt very, very sad because I felt that I could, if only I could have perfected my method, and if only those others had listened to me, I could have saved them. I felt that people died if they shouldn't have died.
What would you do if people had serious diseases?
Well, it depended on the disease. Some diseases we could cut the diseased parts of the body away, but there are others that I'm afraid I couldn't do much for. We tried to make them comfortable, but, well, at least in my wards we tried to make them comfortable. Well, I'm afraid some people weren't so helpful. But I've never actually been in the hospitals I run myself.
Do you always feel depressed when you try out an experiment and just do it?
The pupils are aware of the answers to these questions. They have taken on in a small way the conventional role of the teacher by encouraging Lister to expand on the problems he is faced with. They're not really concerned with the answer to the elements of polarity posed by their questions, but are more interested in Lister's reactions to their promptings.
So not wanting to go through with operations.
Sorry?
Have any patients not wanting to go through with operations?
Many of them. Do you know that I've had patients who come to me and they said, "You're not going to put carbolic acid on my legs because it'll burn." And I said, "It's the only way you're going to survive." Would they listen to me? No. They wouldn't listen. And not only them, of course, it was the doctors in London. They were the worst. Cold water. Lister is here using the indicative open interrogative form. It allows him to provide a substantial amount of information, as well as provide a level of implication in his statements that the pupils can follow up.
Young medical students, we are standing or sitting like you are used to.
Certainly.
Is that possible?
Oh, certainly, yes.
Did you lecture in your operating theatre?
Oh, yes, we certainly did. We used to have a semicircle of seats.
Could we do that? Let's stand in a semicircle. We can't sit, I'm afraid.
No. In my experiments, I've taken flasks like this. Actually, more like this one here. This isn't exactly the sort of flask I did use, but it's similar. I take a flask like this, and I'll fill it with blood, or I'd fill it with a broth, a beef broth, and I'd seal it. I'd boil the broth. I'd put a muslin cloth over the top here, and then I would draw out the glass tube thin on this end, so it was still open, so the air could still get in. But the germs couldn't get in because they couldn't get through the bends in the glass tube. I took those flasks around time after time after time. I showed them to the people. I said, "Look, this flask has had blood in it for 3 years. It's had beef broth in it for 3 years. And it's perfectly clear. And the blood is perfectly good." But they said, "Oh, no. They said, they just didn't believe me. They said I was a quack." At the start of this session, the teacher is working out of role in the normal classroom context.
And just sort of settle yourselves around so that you can see this table here. But I'd like to be sure I keep looking at you in your groups. And you'll notice today I'm not even putting on my examination gown because we've a lot of work to do before we actually start the examination this morning. You'll also notice, of course, that the gentleman who's been being Dr. Lister for us every day, today isn't dressed like him. And that's not because he's forgotten his suit, but because I said, don't change into Dr. Lister's clothes today. Because today he's going to represent him just like you will in your pictures. We're going to make pictures that tell stories. First of all, we're going to make this gentleman tell a story of Dr. Lister's time, and you can help me make the picture. Would you mind coming forward? Now, you can put on Dr. Lister's glasses so that we remember that you're going to be Dr. Lister for us. Well, what do you think? Does he look as if he's annoyed with the microscope? Is it right? Is that what we want it to be? There's something wrong somewhere. Yes. See what happens if he walks now nearer to the microscope, still saying to himself, and it's in here that it's wrong, there's something wrong about this, and tell him when to stop, right?
Here, the pupils are using the teacher as a model to construct a picture.
Does it look cross? Yes. Now then, do you think we've made enough pictures for you to know about making pictures of your own? Right. Spread out then in your groups, and we'll all try one together now. And what we want you to do is use the picture to help you decide on an accident that Dr. Lister might be called to deal with. The picture shows some people. There's always a lot of people in the pictures, and they're always working. What we want you to do is make the picture of when they've been taken home and you're waiting for the doctor. Right, that's yours, get on with it. Start. That's yours, get on with it, 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 start. I think that's probably better than the group. That's yours. Now, put your picture, you know a cow has some rambles.
We are going to be the long His job was to make clean pots.
I want to know where you got that bandage from. Now you just think about your picture. Where did they go and get a bandage from? They might tear a lump off their dress. Right, well you need a label on that. That bandage is made of a lump of a dress. Well, what you will need to do is write a notice about this lady has been kicked by a cow whilst milking, won't you? Then we know what this accident's about. Well, you didn't know you were going to have a fractured skull and a bone problem today, did you? Right. Now this one, are you ready? Make sure everything's clear for your examination picture. Well now, you will have two pictures this afternoon. You'll have the picture you've been using, which is full of clues about problems when people are sick, health hazards, things that can make that wound worse. You've also got the picture you've made of an exact accident. And what we want you to do in your examination is work in groups and list every hazard to health that you can find from that picture where the accident happened to that picture in the house where you tried to deal with it. Now, is that clear? So you know that the lady who had an accident here got kicked and trampled on by a cow. So you know the problems of the dangers to health there. Today, you have a different task to do for your examination. I'm going to read out to you quite carefully what this task is. For today's examination, you have to plan for that time when you may find yourself at high speed, taking all your instruments to work for the good of sick people. Any problems? I'm in the office. I'm just going to phone up to see how much longer they'll give us. Does anybody know the number of the British Medical Association?
In this session, the teacher changes roles from an examiner to a factory manager of an engineering firm. This is signalled by a change in the interpersonal relationships as well as the language used. As the examiner, she uses a declarative modality neutral form. As the factory manager, she changes her role by using the inclusive us to identify with the group. The immediately following use of the closed interrogative, does anybody know the number of the British Medical Association, helps the pupils identify their roles as expert engineers.
For a minute. And do you know how high this one is? How high this table is? Well, let's stand back and have a look. I'm 5'6". I don't know in centimetres. Have you got a centimetre ruler?
There's nobody's anywhere that can put the operating table on it. Can it put it in the middle and not get bashed at the back or at the front? I think because you know how the ambulance swaps through traffic. It's easy to get a bump on the back. And also in the middle of the front. Just go say the ambulance there. Because it would move from there to there. If I had a after it goes to a certain temperature, look, they make a thermometer. Right. There. So many degrees, right? Yeah, she goes again.
The pupil's use of the declarative, modality assessed, almost certain, continues as the team struggles with the design of an automatic accident-proof boiler.
But how's it going to just float up and hit the buzzer? Oh, of course, because it's all the roof's like, you know, it's all the tiny little needle. I know the needle would float up. Or even if the water hits the roof. I heard it just had the noise anyway.
Yes? Morning.
Good morning. I believe we have an appointment with you, the factory manager?
Yes, you're from the British Medical Association.
That's correct, yes.
Will you just wait here a moment? It's the man from the British Medical Association. Now look, he knows we haven't had much chance to discuss this, but at the same time, when we tell him about things, make sure that you explain what you mean if you can.
The teacher, in role as a factory manager, announces the presence of the man from the British Medical Association with a series of declarative, modality-neutral statements which reinforce the drama framework.
My engineers are just busy finishing off their plans.
Would you want to get someone who has done that one? I think that would be better because it wouldn't need as much.
That's a very important one.
We made it of a lot of steel outer case with...
What's this going to be inside? What's the stuff inside made of?
It's made of foam rubber and the sterilising unit is like liquid. So the foam rubber soaks it up and keeps everything sterilised.
That's a very interesting innovation. So whenever the instruments are put back in, they're automatically sterilised. The drama framework provides the pupils with the right to describe their work with certainty. The representative from the British Medical Association expresses his interest and appreciation through his comments, but the pupils are firmly in control of the knowledge. They continue to use the declarative, modality-neutral form in explanations of increasing complexity. The full-size bed, we can just use this as for an emergency.
And the locks, they have a cord that you push in, and then undo the combination and it'll open. An identity card.
I see, so a magnetic identity card. Fine.
Use it. There's another special thing we're putting on where it identifies his fingerprints.
Well, that sounds even better than the radar system for security. You're going to actually key the fingerprints of the surgeon to the box itself.
Yes.
We'll have to have a system if the surgeon changes over, you know, on shift duty or anything. Have you got a backup system for that in case?
Yes. We're putting two systems on. We're putting one for the staff and one for the surgeon.
The ease with which a pupil answers the difficult question over backup systems shows the drama framework operating across the full range of language the pupil has at his command. He draws on his knowledge of organisational structures and occupational roles when giving his answer.
And then he's going to knock. Is there a place you could knock on? Where will you knock? Which bit are you going to knock on? I mean, are you going to actually knock on his desk right in the room, or...?
The dramatic convention of entering the past is established by the pupils knocking on Lister's door.
This century says, come in, right? And I don't know what you'll do to explain that, you know, we don't belong to his century. I don't know whether he'll ask you or whether he'll expect you to tell him. I think you can manage. Anyway, you can always come back if you can't. Right, let's see what happens when you knock.
Oh, come in. Can I help you?
I'm from a different time. I'm from in the 20th century. And we've come back in time to tell you what modern doctors have invented since your time.
That's tremendous. And can you tell me anything about my own work?
Hey. Ask him to excuse you and just come back and we'll have a talk about that.
The teacher here is operating in role as a member of the group.
Was that all right, do you think? Seemed all right. So if we go again, if other people go, you know, and we'll all have things to tell him, does that seem a reasonable way to do it? To knock on the door, explain which century we're in. You will. Right, what are you going to tell him about? Right. Now, we'll all listen to what he's going to say about this kidney machine, and then we'll see whether there's anything else. Tell us for a bit. Tell us the sorts of things you think he ought to know.
That it does what that a kidney can do whilst the kidneys never charge themselves.
I see. Is there anything else we should tell him about the kidney machine? I don't know how big they are, do you? I mean, can he carry them in a suitcase, or...?
The teacher has left her role as the medical examiner and takes on the role of the non-expert member of the group. She is not a doctor and so does not possess the medical expertise of the group as it establishes communication with Dr. Lister. She uses this role as a foil to enable the pupils to run through and reflect on their understanding before they confront Dr. Lister.
A bed or something, and they plug it into themselves.
They have it at the side of their bed and they plug it into themselves in some way to the blood. I see.
They put like tubes in their body where the part is like so you can breathe.
Yes. You know, one of the things he's bound to ask us, I think doctors are a bit like this, he'll want to know everything, you know. Which bit do you change? You know, when you're dealing with a kidney machine, do you keep pushing new kidneys in and taking old ones out? Or what is it a kidney machine does? That, you know, I don't want you to land yourself with him asking you things and the 20th century can't explain it. Does anybody know what these kidney machines actually do to the kidneys?
Make them work.
They actually make them work better than before.
No, sometimes people's kidneys don't work, so they have to make them work.
Oh, come in. Can I help you?
Yes, I'm one of the fellow surgeons of the person who's just been in. I came to tell you about one of the things that the 20th century has brought. It's called a kidney machine.
A kidney machine? Do you mean a mechanical kidney? I can't believe it.
No, it's like this big box, and you plug it into yourself, and it does the work that your kidneys would do for so long while the kidneys recharge themselves.
I find that amazing. Do you mean that we can actually reroute the blood through this machine?
Yes.
That's fantastic. Is it a mechanical? Does it work by clockwork, this machine?
I think it works on electricity.
Electricity? I have heard something about that. I remember they were working on frogs' legs. You have the jump, the electricity in the nerves. Does it work off the nerves? I find it very hard to believe.
Could you excuse me?
As Lister is in the 19th century, he can't know of the medical advances that will take place in the future. The pupils' understanding of the world they live in is harnessed to provide explanations for a man who can't, because of the dramatic convention used, have their expertise.
Is there anything else about the blood bank? The blood is stored like money is stored in a bank. That's why we call it a bank. Is that right? I don't want to tell him anything that's wrong, you know, for the 20th century. Now, what else are we going to say about that? I've never understood where they got the blood from. From other people. He's sure to want to know how we persuade people to take their, to give their blood away to a bank. Can you cope with that if he asks you? Well, now, let's think then. What are we going to say about how we persuade people to give up their blood? What were you going to say?
Like some people have accidents, so that they persuade them to give blood, so the people who've lost a lot of blood, they can pump that blood into them.
So they do it by saying, will you help somebody who's had an accident? Well, I suppose I would give blood if I thought it would help somebody. What I don't understand is, how do they know that the blood you give fits the person who's had the accident? I mean, I'm a lady and the person might be a man. Can ladies' blood mix with men's blood?
Well, in the blood bank, they're all labelled, and there's different types of blood, and you take a sample of the person who's had an accident, and you pair it up to whatever blood's in the blood bank, the right type, and then you pump it into them.
Throughout this summary, the clause structure is declarative, modality neutral. The pupil has taken on the role of teacher, sure of his understanding and his right to instruct. Is there some classification system?
Yes.
I don't. I always thought that all blood was the same.
There's different blood groups.
Blood groups? Are there how many blood groups are there, do you know? Come in. Have you got something to add to this? I'm astonished. These people have been telling me about that there are more than one sort of blood. Yes.
They keep the blood in office.
In
this stored in bottles.
In bottles?
In blood bags.
What? In bags as well?
Is there anything else that we're going to have to tell him then about this? I mean, how much blood do they take from you when you offer it?
And how much do they take?
Taste.
Anyway, how many think they can cope with Lister's questions on the matter of blood banks?
How do they get it out of the arm? Do they just cut the arm and let it drip into a bowl? The drama has been designed to remove both teachers from the centre of the communication network and allow their roles as non-experts to reinforce each other so the pupils will continue to take control of their own learning. The contrapuntal reinforcement is shown in a series of rapid cuts in the videotape where the pupils' rehearsals to the group are juxtaposed with their answers to Dr. Lister. Is it like...
It's a substance to bending substance.
Is it like glass?
That is glass.
Oh, I see. So I understand the glass, but...
The tube which the blood runs through is plastic. It's got like a...
What is this plastic? Is it like an artery or something? Is it? I'm not quite... I can't quite understand.
So like accessories, sometimes you pump blood into people by, you fill that with blood and you squeeze that and that pushes the blood down and it comes through the needle and into the other person's body.
In this statement, the pupils choose declarative, modality neutral to emphasise their explanations and illustrations on the chalkboard. Becoming infected. Yes.
This is the kind of clothes that the doctor now would use in these things.
You want me to put it on, do you? It seems a
This is going to be the
strange
biggest surprise
material.
of all. Stand well back and let's all see.
Would you like to just stay here and help me with it? You stay here and help me with it. You want me to put on this... Well, I normally never take off my coat when I'm operating. I leave it on. But
I wonder if he realises why we take our coats off.
Well, these in case you spill anything, so you won't ruin your own clothes, and you wear a jacket like this.
really? Oh, so I can understand that, but I usually just have one coat for operating, and then it doesn't matter if it gets stuff spilled on it. I just wear it.
To have dust on, and these are then sterilised. These.
Sterilised?
Yes.
What does that mean? I'm not quite sure of these modern words.
It kills all the germs.
Everything, bacteria.
You mean you actually... What do you do with them to clean them? I'm not quite sure.
It's a special liquid, and you put the coat in the liquid, and it cleans it.
You actually... You mean you wash the coats? Is that what you're saying? After every operation?
Yes. Yes.
That seems amazing. I've never... My operating coat, I never wash it.
If germs in the air get onto your coat, it's like an invisible kind of
No, look. I'm devising this whole new system, and it's the germs in the air. And because I've worn my old coat, it's covered in blood, and it doesn't matter at all.
But if somebody you've just been operated on had a bad disease, and you had blood from that person on your coat, on the blood would be the disease, and then you operate on somebody else, and the disease could get into them.
By using the declarative, modality-neutral form, Lister demonstrates that he's sure of his statement. Nevertheless, a pupil is able to refute him with a clearly reasoned counter-argument that also takes the form declarative, modality-neutral. So the modern doctors, do all modern doctors wear it?
Yes. But when they do operations, like wear green kind of suit, yeah.
Green? I don't like green as a colour. Why do they do that?
I don't know, it's any colour really, but it's...
Mask over their mouth so the germs out of their mouth.
Maybe you ought to see a mask. Has anybody got a paper hanky? Well, we could see what
Surely,
masks are
when I work, I need to breathe quickly, and I wouldn't.
Right, let's show him how masks work and why. Right.
Oh!
Well, I think it's important, don't you? And then he gets it right. We don't want him learning it halfway. If we stand back, maybe you can see what you mean.
Well, when you're doing an operation, you've got a mask and it's got to go over your nose and your mouth like this.
Can I try that? You mean it's got to go... Now why would you want to do that?
Because when you breathe, like, if you've got a... It's like when you've got a cold or something.
So you don't bring it out under the patient?
Are you saying... But I'm very healthy. Are you saying that there are germs?
Everybody has their own tongue.
Does everybody know this, doctors? Does everybody understand this?
Yes.
Even children? Lister's statement, although it is declarative, modality assessed, almost certain, allows an element of doubt to appear. He is gradually moving towards the pupil's framework of meaning.
Stethoscope, you put them to the heartbeat, you put these two in the ear.
These in my ears?
Yes.
What for? What to...
Inward.
Oh, but I've got one of those, much better than this thing. I've got, excuse me, I've got my own listening tube. This is much more direct.
We have much more of the patient's heart with this one.
Is that what it's for? Well, of course, I use it for the chest like this, and so this is what the 20th century doctors use. Should I put it on?
Yes. And then you can speak through the end of something.
You mean you put it just in like this?
So then you can hear people's heart.
Yes, it is. It's very effective. It works very well.
Do you think he looks a bit upset, doesn't he?
I think he done very well in his day.
I think we should probably explain that to him. Do you think we should?
Yeah.
I wouldn't like him to think that the 20th century thought he was a fool. Well, I don't think he was a fool, do you?
No.
It's just a matter of helping him understand what he really did do for us. Yes.
Like Richard said, we should tell him he's done very well. And
The pupils are now firmly in control of the information frame and ready to assess Lister's contribution to medicine. They go on to explain to him his own place in the continuing process in the development of medical science.
Lister lived, really, myself. Dr. Lister, we thought you looked a bit sad then, and one or two of us, or many of us maybe, would like to explain to you something.
this is one for you. Inventing sterilisation, which is used mainly now in the 20th century. Thousands of people would have died because of diseases on instruments and on jackets and in the
I
air.
see. It's wonderful to think that people in the 20th century would carry on the work that I've started. And do you get some sort of, you get a certificate or you
Yes.
pass?
Yes.
And this is part of your examination?
Did you get a certificate in your day, Dr. Lister?
Oh, yes. Would you like to see it? I always have it here in my office with me.
Yes. I suppose you need to prove it, do you, sometimes, when people come and want to know if you're a real doctor?
Well, they like to see it on the wall. It makes them feel better. I think you may have seen this before. There it is. It's my certificate.
Did you do an examination
Oh,
in
yes.
historical aspect?
Oh, certainly. Certainly I did. Yes.
May we just have a word?
Oh,
Do you excuse
certainly.
us?
Certainly.
Just wondering if Dr. Lister would like to present you with your certificates for the examination. Do you think he might? Shall we ask him? Well, now, this has to be very formally done. I'm not sure how they did it in his day. Dr. Lister?
Yes.
When you received your certificate, did all the people come to one place, or what happened in your day?
Well, we all sat in the hall, and they came up one by one to receive their certificates.
I see. How would we have to arrange the chairs to have it done like you got it done?
I think we'd have to have them in 2 or 3 rows.
Go on, get the chairs ready. We'll come on. Dr. Lister, may we ask you, to present the certificates in your old coat, not your modern doctor's coat.
In the final section, the past and future symbolically merge as Dr. Lister, in his old 19th century coat, with a bright 20th century stethoscope around his neck, helps present the certificates to the successful candidates in the History of Medicine examination.
To give the certificates and you shake their hand.
Yes.
Do you like that? Let it be known that Wendy Carroll has successfully passed the History of Medicine examination. Will Wendy Carroll come forward, please? Congratulations, Dr. Carroll.
Congratulations, Dr. Carroll, on passing the exam.
Let it be known that Yvonne Elizabeth Yates has successfully passed the History of Medicine examination. Congratulations, Dr. Yates.
Congratulations, Dr. Yates.
Let it be known that Catherine Johnston has successfully passed the History of Medicine examination. Congratulations, Dr. Johnston. Let it be known that George Albert Edward McQueen has successfully passed the History of Medicine examination.
Congratulations.
Let it be known that David George Moore has successfully passed the History of Medicine examination.
Congratulations, David.
And let it be known that David Anthony Elsander has successfully passed the History of Medicine examination.
Congratulations.
And let it be known that Kevin Dennis Bourne has successfully passed the History of Medicine examination. Those are all the candidates for today. Congratulations, ladies and gentlemen, and thank you very much for the studies you have undergone this week and the ways in which you have carefully prepared your examination work. I'm just wondering if there's anything else we need to say or do before he has to leave us. May I leave that to you? Thank you. Thank you. And don't say